Hello everyone, I'm Christian Blessington. I'm the Community Health Planner at Florida Department of Health in Sarasota County. So I'm going to cover the health and social equity side of the assessment report, and I'm a little tall. So I think what we saw earlier in the keynote presentation really covered a lot of the facets of how health and sustainability are connected. But quite often those connections are not readily apparent, because there's really a complex interplay between the built environment, social environment, and the natural environment, and these connections are both to health, they're both indirect and direct. So one example of this complex connection is how adopting, for example, more sustainable forms of transportation can have health promoting benefits such as reducing air pollution, promoting more physical activity through active transportation among individuals using those alternative methods, and that in turn can lead to lower levels of chronic disease, such as cardiovascular and respiratory diseases. And so really a sustainable community is one in the context of this report that recognizes that the health of our natural environment is intimately connected to the health of our human community. So linking health and environmental protection and policy really fosters a more sustainable society, and it creates greater harmony in the social equity frame and reduces the risk of unintended outcomes such as health disparities, which I'll cover pretty soon here in my section of the presentation. And so really over the last 10 years, Sarasota County has made some significant progress, and we're just going to kind of overview that as we go through this presentation. So just some quick demographics. Overall, in the last 10 years, Sarasota has grown by population. We're demographically quite aged and elder community. We have out of county is over 100,000. We are the third highest in the nation by our median age, which is 53.9 compared to the state. And just for some other socioeconomic indicators, our poverty rate has increased. That's really kind of an outcome of the Great Recession. But at the same time, unemployment has been coming down, and laws such as the Affordable Care Act have reduced our levels of uninsured to where we are actually below the state level, and we're doing pretty well in that regard. So just some of the key data points. So when I mention health disparities, I want to just cover what that concept is. So this data really kind of overviews what that is, and that's really a great indicator of the social equity of your community. So health disparities are situations where one group of people in our community are sicker or have greater mortality rates compared to another group in the community. For example, African Americans in Sarasota County have higher cancer mortality rates compared to Caucasians. And so really health disparities are a symptom of this inequity that exists in our community, and are kind of a sign of unequal access to vital resources such as health care and quality of care too. So, addressing these disparities is important from that health and social equity standpoint because they still persist, and they persist mostly because of differences in access to medical care and other factors. And so really, what these data points show is if you had a more equal type of community that didn't have health disparities exist, we would see these gaps between different racial populations be narrowed. But what's been great over the last 20 years in Sarasota, just in these graphs, is that we are seeing these numbers come down significantly, and those gaps are narrowing. But there are some things such as infant mortality rate, which is one of the biggest ones that we use in public health. We actually have been seeing an uptick across all different racial groups, which is disconcerting. But overall, generally, the results are great. We've been coming down, but their gaps are still existing, and so these disparities are still persisting. As far as some built environment and some alternative transportation indicators, Sarasota is doing pretty well as far as number of people that are biking to work compared to the state. And at the same time, we're not doing so well, though, as far as public safety with the number of pedestrian deaths. That has actually been increasing and is a little bit larger compared to the state. And that's a byproduct of the built environment, such as, the keynote presentation, we saw those important interconnections of promoting complete streets and how that can protect public safety, especially for pedestrians. And so if you have roads which are more geared towards vehicular traffic and not so much for alternative transportation, these numbers are going to go up. So just some overall conclusions that we got from the assessment was, generally the health disparities have been decreasing over the last 20 years. But we have seen an uptick in infant mortality rates. But the great news is that overall chronic disease rates are lowering, and those gaps are narrowing. They're on a downward trend, so that generally is a positive thing. For the assessment report, we were using information from some community input we gathered. Recently, the health department conducted a community health assessment over the summer, And so we had a series of community conversations, basically focus groups with residents. And these were just some of the input we got. So these were the 3 top priorities: were healthy weight, access to care and resources, mental health, and substance abuse. And so really, mental health and substance abuse was pretty common. And so that was really critical that we want to address those going forward as community priorities. And yes, most of the information that I just covered is in that report under the social and health equity section. So I'm going to turn it over to Don, who's going to cover food.